Smart Vaccines Production Konza City kindly come on stage. I'd like also to call upon Dawit Mojes, the SG Ethiopia Healthcare Federation. I'd like to also call upon Dr. Emmanuel Togun, Private Healthcare Sector Association. I also like to call upon John Paul Omono, Senior Advocacy and Policy Officer, kindly come on stage. I also like to call Professor Kiriti Pradhan, Professional and Capacity Building Expert from India, kindly come on stage. Finally, we have Dr. George Kosimba, if you're around, kindly come on stage. And Hitesh Upreti, the CEO, Biofarm Tanzania. If you're around, kindly come on stage. So over to you, Dr. Lucy.
Thank you very much, Nelson. Thank you very much, Nelson. And a good morning to all of us who are here in the room. It's a pleasure to have you join us this morning. But because I can see faces looking at me in wonder of what it is that we would like to share, allow me to stand so that my panelists can also get a warm reception from yourselves. I'd like us to do an assessment. If I ask you how you're feeling, and you tell me that and you feel that you're feeling great, or you're feeling excellent, or you're feeling so-so. So if you're feeling excellent, you're going to put up 2 hands. So that gives us an idea that we have people who are feeling excellent this morning. If you're feeling great, put up 1 hand. And if you're feeling so-so, just wave it around your waist area, all right? So let's do a quick checkup on who we are in the room. How many of us are feeling excellent? Aha. How many of us are feeling great? Okay. And how many of us are feeling so-so? All right. Very good for your honesty. Let us hope that in this 1 hour of conversation, where we will be discussing about commercializing research across the region, we will be able to convert those who are feeling so-so, hopefully to feel great, and those who are feeling great to turn out to be excellent. But of course, our greatest achievement will be for those who are feeling so-so to turn out excellent. Already we have a panelist with me who will need that conversion, so we must give him the best of what we have. As introduced by Nelson, my name is Dr. Lucy Muturi. I'm a faculty here at the Strathmore Business School, and we're very delighted to be hosting this Healthcare Expo this particular season in time. And for the purposes of the conversation we have, the panelists who are here will be sharing with us how do we consider commercializing research. There's always an opportunity when we study further, and it was very good for UNICAF to start us off by saying that they're actually offering opportunities for study in a more flexible manner. So there's no end to learning, and there's no end to knowledge. But at what point does that knowledge become value for those for whom it was intended, but most of all, for those who are actually conducting it? So without much ado, I'd like us to start off with Professor Matilu Mwau to share with us his remarks in this topic. Karibu sana, Professor.
Thank you. Thank you. The reason why I'm wearing a mask is, first of all, I wear a mask every day. And number 2, I have a homa. I don't know what it is, a flu. Yeah, I know it's not monkeypox. And I'm happy to be here. I do some assignments that are probably relevant to this workshop, but I must start by introducing myself. I'm an infectious disease specialist. I'm a professor of infectious diseases. I work for the Kenya Medical Research Institute normally. Normally it's like 10 to around 3 p.m. there. But I have other assignments, and one of the most important ones for the purposes of this forum is that I head something called the Smart Vaccines Production Facility Initiative at the Konza Technopolis. If I want to take you back a little bit, I can tell you that Kenya has 4 initiatives that in the near future will be producing vaccines. for our local use and for selling to people around us, to other countries around us. 4 initiatives. The first one is the BioVax Institute or BioVax company that was established by the government. The second one is a smart vaccines production facility that I head. The third one is probably Moderna, you've heard about it. And the fourth one is probably going to be Dow Pharmaceuticals in Thika. And the ones that are quite well advanced are the facility that I run, or the initiative that I manage, because we have money, and the government, because government has a factory that prints money, and then Moderna, because they're quite serious in what they're doing, but also Dawa is somewhere because they have already started the feasibility study. So, looking in the future, what does this probably mean for you? We're going to be needing in Kenya people interested in research and development around vaccines. Those ones who make the products, design and construct them, those people who test these products in animal studies, and those people who test these products in humans for safety and for efficacy. These groups of people are going to be required in the future. And in between there are those who look at the quality of those products, quality control of vaccines. Okay, so if you are in this business, you should ask yourself whether there are innovations you can imagine that may be relevant in that space. And then, of course, there are other, associated acts. For instance, information management technology, vaccines. The business or logistics of vaccines, selling them, marketing them, and stuff like that. So there's a lot for everybody in the future with regard to that particular initiative. I think that's all I want to say for now. I think the other parts of the discussion will come up as we go. Thank you.
Thank you very much, Professor Mwau. Could we kindly give him a warm clap? At least we've had something is up in the air for the taking. At Konza City, where he's heading the Smart Vaccines Initiative, opportunities are there. And for the people in this room, our belief system is that you're here because there's something about research you're interested in. They're looking for people. Are you the person they're looking for? More to that as we continue. So we'll be hearing in from Dr. Emmanuel Togun of the Private Health Sector Association in South Sudan. Karibu sana, Daktari.
Asante sana. Good morning, ladies and gentlemen. How are you doing? My name is Emmanuel Togun, as she mentioned, and from the Private Healthcare Association in South Sudan. And in this topic, we're talking from research to commercialization. While they're looking on the big scale, sometimes it's also good to look at it from the small scale as well. And that's where we're trying to look at it now from a business person's point of view, going into sectors that, for example, you haven't ventured into before. Some things that, let's say, IT and how to take your research in IT to actually come up with a finished project and the final project and how you're going to make money out of it. Or even if you're going to venture into something else within the health sector and what you should be looking for and what are the trap holes and footholds and how to get to actually make money out of it. Because in most cases, most researchers are just end up in the library somewhere online and you'll just go to a forum and talk about it, but you can barely make any money out of it. And there's some good ideas out there, but I think a lot of the people who actually do research don't know how to cross from point A to point B in actually monetizing it. And that's something I think most of us don't know yet, but we'll find out a way. Takes a lot of in taking risks to do that now.
Okay, thank you very much, Dr. Emmanuel. The query, and that happens to be plaguing a lot of people. I have a research product or concept or idea. I have come to its fruition, but how do I take it to market? So if there are any of us in the room that are thinking around this area and you're struggling with that particular probability, we have somebody in the panel who can help to thrash it out. So we'll be listening in next to Professor Kirti Pradhan of the healthcare management professional, and he's a healthcare management professional and capacity building expert. Karibu sana, Professor.
Thank you. So I'll bring in a little different perspective. A lot of us must be thinking this research commercialization is for somebody else, government, scientists, but actually not. Today, our world has given us the opportunity for each of us to think creative, think innovative, and if that clicks, that becomes a commercial product in the market, helping many families, many population, and many in the world. I'll give you an example. One is research. Research is a process. Research is not something which is like a product. It's a process. While doing the research, you may come out with something, you may not come out with something. If you come out with something interesting, which is useful for the society, humanity, then you patent it. There is another step called patent. Very simple, not a very rocket science. Every country has a process. You can apply for a patent, you get a patent. Once you have a patent, you go for commercialization. If your product has market value, okay? To simplify it, for common man, each of us can do that actually, even without doing a big research and publication. I'll give you an example. There is a gentleman, he was roaming at the airport because flight was late. In his brain, he thought, there is nothing, when at a young age, people, lovers and they love all that people, they give gift as perfume as a gift, isn't it? When you are at a teenage, that's a commonly used gift, perfume. He said, why can't we create perfume with alphabets? Let's say S is loving P. So if he wants to give a gift, is there so he can buy a normal perfume bottle from anywhere and give. But if that can be alphabet A with perfume filled in, B, perfume filled in, do you know, he patented it. This was the idea in the airport while killing time. He patented it. So that is the value of ideas. So it's a patent. If you see any letter alphabet with perfume filled, which people can gift each other by name, that is his idea. So it is as simple as that. So sometimes we get very confused. Oh, patent, research, commercialization, these are only for big people. No, anybody can do this. Another doctor in India, he's a cancer doctor. He was struggling, like people have throat cancer, voice is lost. He was struggling to import some voice box to put into and it was very expensive. Poor people can't afford. It was imported from some country. He created something called voice box in his own way, looking at that, and he Indianized it. It's $1. You can Google it, Vishal Rao, Dr. Vishal Rao, voice box. It's there in the Google. So the point is, and he patented it. Now he's selling it. It's a commercial, but he's not making big money, but it is making its own money. So patented research and patent and innovation, commercialization can be a track. All of us can do that. All of us. In our own way of thinking, own way of research. So please, I want to bring in that concept into this discussion so that we should not be thinking that research and commercialization is somebody else's job, not my job. Thank you.
Thank you very much, Professor Pradhan. You would imagine that if we talk about research, we're looking at a scenario of people who have a minimum of 3 degrees. Your first degree, the second one, and then probably your PhD. But from what he's describing, there's also an element of observation and being able to be creative and innovative with what you have seen. And that equally has an impact, and it is a research in itself. So we'll be looking to hear more about that. But we'll hear in as well from Dawit Mojis, who's actually the Secretary General of the Ethiopia Healthcare Federation. Something I like very much about this panel, as you can see, is the regional effect that we have. You have had somebody from Kenya, from South Sudan, from India. Now we have an Ethiopian also to share a perspective. Karibu sana, Dawit.
Thank you very much, Doctor. When we go from research to commercialization, I'll give you my own life experience. I don't want to frustrate you, but it is not that smooth ride like what we see on the paper and on the documents. Just like Dr. Emmanuel mentioned it. There are so many things that we have to expect So in my own experience, when we build a hospital, according to the research, the feasibility study, and so on and so forth, I was believing in my intuition. I was doing that for my mother, my late mother, who passed away in a car accident, Sister Agnesia. So I said, we have to build this hospital in her legacy. Apart from the research and everything. The research is very important. The feasibility study is very important. But the thing is, when you put things on the ground, it's not as easy as what is written on the research document, the results, the anticipated outcomes, and all those things are not that flowery when you walk the talk. So when you want to make things happen from the research into a real world, we have to expect so many bumpy roads. The first thing, the policies, the investment proclamations, the supports that we were thinking about, the infrastructures, all those attributes are not that easily available as we think or anticipate in the real world. Even the political situation at the current time cannot be defined in the research when you're experts studying what you are anticipating to do or something like that. As you know, there are two professions that will not get fired for their conclusion. A weatherman and a consultant. Because so many things do have a major valuable role to anticipate or to change the outcome. So after getting those researches and all those documentations, and when I was walking the talking, starting from building, designing the hospital, all the way to delivering the service, you have so many kind of challenges that were not written or anticipated on the research, on the documentation. So what I advise is, when we do commercialize whatever things after research come to our table, we have to be able to have that big heart and shoulder to carry those challenges that we are not thinking of today, starting from the political situation, as I said, the investment policies, even the availability of experts. All those things have to be, born inside and fight with your intuition. We have to follow sometimes our gut feelings also. Thank you.
Thank you very much, Dawit. It's always a set of things to hear a personal story. And I think there are those of us who probably can articulate what he has just said. And there are those of us who are in the room who are probably wondering, in Kenya we have a way we say it, mambo kwa ground, things on the ground. What would those things on the ground look like when I want to get started? So at least Dawit, we can see we'll make a reference to you on the same. So now we're listening to John Paul Omono, who is a Senior Advocacy and Policy Officer of PATH, and he's very charismatic about what he does. Let's hear a little bit more about that. Thank you, John.
Thank you so much, Dr. Lucy Muturi. Good morning, everybody. Good morning. I think I saw so many two hands that were up. We only had one who was sure, yeah? So my name is John Paul Omono, as has been mentioned. I'm the Senior Advocacy and Policy Officer. I wear many hats, but for the sake of today's conversation, I'll speak to one that is related. I lead advocacy for research and development across Africa, and also regulation of medical products across Africa. So I do a lot of policy work. The rest of my panelists are, I would call them the supply side. But before, from where they are to where the products need to get, things happen in between. So I'm that in between, not watermelon, but the in between. Yeah. So in terms of the policy work, I think it is important that we realize where the gap has been. There's always been the siloed approach. The researchers sit in the labs, do their work, or in the field. The manufacturers sit somewhere, do their thing, and then the community sit somewhere, wait for things. But how then do we connect all these three, including now the government, to a point that now we speak one language? It is important that we start looking at the demand side. So today I will be speaking quite a bit on the demand side of things around research to commercialization. And what are the things that we need to start thinking about, and how then do we need to plug into that space? And also the place of this is, I'm glad you mentioned that. We do have, a number of policies that are either in place or not in place that would then deter or would be a barrier from research to commercialization. How then do we look at that and push forward? And of course, we need to also recognize that things don't happen in a vacuum. Things happen within a space. So how do we then engage decision makers and policy makers and tell our story that fits in their agenda so that they start seeing the value proposition for what we do? Thank you.
All right, thank you very much, John Paul. So we're going to go straight into an interactive session. I will share a few queries for our panelists, and then we'll open it up for the floor. So I'll give you a chance to keep thinking through the different aspects of briefs that each one of them has given. Today is your one day when you're allowed to be selfish. If you're going to invest your money with us here, then at least ensure you take away something. And it needs to be the something that brought you in the first place to this room. So my hope is that the rich experiences that we're going to receive from our panelists inspire you, because that is the desire that they had when they were choosing to be panelists for us today. So just to get started, from a point of what it takes, and Dawit Mojis, you have given us your personal journey. Could you kindly share with us a little more about the characteristics of resilience? What are the personal attributes that someone needs to have if they're in that environment of doing research and they have a vision of actually going into a commercial aspect of it?
Thank you, Doctor. So we have to be very resilient, that's for sure. The main thing is we have to reboot our system, our mindset. That's the main thing. We have to think of what if kind of thing, as usual, but in like a country where I'm from, Ethiopia, where policies are always changed, even before you know that a new policy has been implemented. It's already been modified and everything, the landscape, the ecosystem has been changed. So we have to be very resilient, one thing. And the second thing is we have to have a good source of information. We have to be like 24/7 on that path. What's happening? Who are my competitors? What's the government supporting me with? What advice the suppliers having this time? Now, I'll tell you what the condition in Ethiopia is. We're very much in challenge of access to finance. All the commercial banks would rather lend their money to traders rather than to investors in the healthcare, because it is more profitable for them to lend to the traders, bring a container of maybe chewing gums, and then sell it in the afternoon and give them back their money and go back for another, borrowing. While us, we go once in a year, invest that, and come back after a year and settle our dates, and they are not that much reluctant to work with us. Okay? So all these type of things will be happening. And now, even currently, we are having a very big difficulties of getting foreign exchange because of the situation that we're facing now. So in that case, we are not allowed to import that much medication and hospital supplies in the country. You see, so we have to always be on the guard, anticipating what's going to happen. What if tomorrow a foreign exchange will not be allowed for our cause? And then what are we going to do with our patients? What am I going to do with my inpatients? And so on and so forth. So we have always to be on the guard, anticipate everything, put some plan B, C, D, depending on where you are in the country, and then, wait for a good happenings. Thank you.
All right, thank you very much, Dawit. Now, we were given a perspective that it doesn't have to start big. It can start small. But there's always the challenge of, even as you're starting small, how do you get started? So I would like to request Dr. Emmanuel, could you share with us a bit more broadly? I am a small player. The greatest of innovations we've seen have started in people's kitchens, garages, backyards. They do not start big, but they are now big. But what are the realities of starting small? How does somebody who then is an early inception proposer of their research even deal with issues of financing, of funding, of creating collaborations, and bearing in mind that most of the time when you're starting off, you have also very little exposure in terms of what are the things around you that can be of support. Could you kindly just shed light a bit more on that for us?
Thank you very much. Yes, it's very hard to start small, and one of the biggest challenges is when you start small with your concept, with your idea, you have a vision. In most cases, nobody sees your vision. You may think, okay, I want to do A, B, C, D, and this and that and that. And even if you may not be small, you may be a big company, but you want to cross into a certain field, a lot of people will not see that vision and come in to fund or support and everything else. And I'll give you an example. I was watching a blog by this guy, Busi Tembekwayo. I don't know if you've heard of him. And he's a big VC at the moment. And at that time, he was a senior banker and working very well. And Steve Collimo of Safaricom was moving around looking for people to fund M-Pesa. And at that time, they went to various banks and they were looking for about $3 million. And they gave their proposals and this, and everyone was thinking, why would we pay money to this idea that is going to send the money from one phone to another, and yet we have a bank to do this job? So of course, they refused. They said, thank you very much, and we don't need, I don't think M-Pesa will work. So please go back on your plane and go back to Kenya. And of course, they missed out on that. Today, Safaricom is a very, very big company. And he said that's one of the things that he regrets not investing into, because he didn't see into the vision of that. So if you have the vision and you're trying to get your financing and everything else, first of all, identify your niche. Try to keep it as simple as possible so that the other people can actually get to see the vision and what it is. What is the vision? What product are you selling, or what service are you providing? Who are your target markets? For example, what is your plans to escalate from A to B to C? Financing is a bit of a problem because in most cases you may have zero experience, so you can barely go to a bank. Yes, you can write all the beautiful proposals and everything else and all that. Your business plan could be top grade. You bring it to Strathmore School, you'll get an A for the business plan, which is fantastic. But it doesn't really cut in the real world because people want to see what are my returns to it. And then you'll have now to reach out to other people to try to get the funding for it and all that. Another person, he's given a personal example, give an example of a friend who started a business and it was in recycling. So using plastics, they did all the research. Don't ask me about what kind of plastics it is. They did all the research on which plastics are best to be molded and to be made into wooden poles. They chipped in their money a little bit and worked on it, got into small partnership, started making the poles, things broke down again and blah, blah, blah. But they had the technology, they had the vision on, one, taking out a lot of the plastic wastes from the market, from the environment, melting it at some very high temperature and squeezing it into poles, which will come up to about 2.4 meters. And this can be used for fencing. So they hit a snag somewhere and we found out about it. And I got to read their white paper. Ended up moving around into Korogosho and all these other places, learning which kind of plastics it is and what they use and all that. And it was beautiful because they wanted now to rebuild their factory after it had some issues. Now, they had done all the research. They had done all the policies and having to deal with cabs, and I was sitting there listening to all the stories and the taxations and all that. But we bought into it. So together with some other people, we all invested into it because, one, it was a good idea. We saw the way, from the way they actually presented everything else and from the way they present their proposal, we saw that there is a perfect market for it. It's a niche area. One, it saves the environment. You don't have to cut trees. Number two, you're cleaning up on the waste. And there's endless supply of waste, continuous supply of waste. So it's how you present your vision to go from your research to commercialization. There'll be people out there who are looking to invest in some of these ideas. There'll be people who are out there who will be willing to help you move on. And once they come in, now it's easier now to scale up, to go to now the phase 3, for example, where a bank will start, because now you've gone into the market or you have a bigger valuation of the company or your whatever it is. And then it's easier now to approach your bank because you can say, okay, now we've put this much into it. We have this much of equity in this. And the banks will now willing to help you move further. I hope that helps a little bit. Thank you.
Wow. That was an excellent response. Thank you very much, Emmanuel, for that. And I think also very curious. Someone from South Sudan knows where Korogosho is in Kenya. How many of us would know the equivalent of Korogosho in South Sudan? But you can see the appetite for investment doesn't stop where your borders are. Every time an opportunity for research comes up, and one of the panelists had alluded to it, we rarely get to understand the policy environment that dictates it. And depending on your level of understanding, even the very policy documents themselves have language we have no idea about, because part of our exposure doesn't give us the understanding of the wording that they use in those policy documents. Then it doesn't help that there will be a multiple set of institutions that regulate that little research that you're trying to get off the ground. John Paul, because this is your area of expertise, a seasoned researcher in the room, a starting up researcher in the room, has no idea how to navigate the policy terrain. Could you please share with us some best practices of how, if I'm getting started, or I have been around, and I actually want to go into a commercial environment for the work that I have, how do I navigate the policy environment that will be within, and also the regulatory element of things?
Thank you so much for that. And I think it's the elephant in the room. But I would start from the simple thing. If we do have a researcher and you are in an area, it means you must have at least tried and figured out a few things. Number one is, what is it that you want to do? And who would be some, or which are some of those ministries or agencies that you need to work with? But that is towards the tail end. One thing that we've noticed that is really working is from the government side, and I would say this because I've worked with government a lot, both at country level and at the East African, at the continental level, is we do have a lot of initiatives currently in place that are trying to harmonize the regulatory space, both for research, but also for products. We are aware that right now in the continent, countries are ratifying the Africa Medicines Agency, what we are calling the AMA. And AMA is trying to solidify all these regulatory spaces that are happening and reduce the bureaucracies for products evaluation. So, of course, countries like Kenya, we are in the process. The document just got passed in cabinet a few weeks ago. I was part of the process of developing that document. We do also have country-specific regulatory processes that are trying to harmonize those processes. Our main regulator, of course, is Pharmacy and Poisons Board for regulation, but we do have KEBS, the medical technologies, but we are glad that through the African Union model law of products regulation, it's trying to also push countries to be able to reduce the bureaucracies and the number of regulators that are there. Or even if the regulators will be there, they will be within one single roof, so that it makes it easy for even the regulators, the time it takes, the turnaround time, and even the amount of fees. Because one of the biggest barriers to researchers is the fees that needs to take, the time it takes to evaluate a product to the time it gets to the market, and we all know what that means. The final person, or it's the patient who is going to suffer, because if I'm a researcher or I'm struggling to put things into the market, the final price of that product will be a composite of all the costs I've incurred throughout this process. So this kind of initiatives needs to be backed by all players. Kenya is trying right now to come up with what they are calling the Medicines and Medical Products Bill of 2019. Previously was the Kenya Foods and Drugs Authority Bill. They dropped out the food part of it. But do we have such kind of initiatives? If I'm a researcher, I need to be on top of listening and hearing a lot of this and following these conversations both at continental, at regional level. Right now we have the East African Medicines Regulatory Harmonization, which was the first rec in the continent to come and come together and say, we are regulators. It is important that when a product has been regulated by this body, then it doesn't have to go through the same process in Tanzania, in Kenya, in Uganda. So those kind of conversations need to be on top of your agenda. And why am I speaking about this? Because at the point that you have this product and you want to introduce it in 3 or 4 countries, you need to know where to go. So if you want to introduce it at the continental level, then your point of submission of your dossier should be at the AMA level. If you want to introduce it at the regional level, you need to plug it the East African, because then you're going to reduce the time. And of course, the regulators have also tried to reduce the turnaround time for all this. If it is at country level, that's also another thing. But let's also speak about, if you are doing a product, you are commercializing a product, many a times our products are either, or rather our companies might not be GMP approved, the good manufacturing practice. And you will be having the limit to which such a product can go. But I think we have started a conversation across the continent so that good, or rather best should not be the enemy of good. The fact that the product is being produced or is getting out through a company or an institution that is not GMP approved does not mean it is either substandard or falsified. But it fits the context of the target population and will address the needs of those target population. We need to start speaking to our leaders so that they start, that thing of buy Kenya, buy Kenya, build Kenya. We need to have buy Africa build Africa. And that conversation must start here, so that for our companies that are either not GMP approved but are producing good products, or industries, or even the innovations that came up during COVID, we had a number of them. How did we drive those within the continent or within the country? And did we speak to our leaders to the point that they're able to understand that the products that are getting out from students from KU or JQuat can also do the same kind of work? And how then do we work within the policy so that we can help and spur these innovations into the market? I think those are the things I need to speak to, where we have that, we're able to diffuse the work we do within the policy making tables, and then make our story known to the policy makers, who then find within their spaces how to introduce that and help these new innovations into the market. Thank you.
Thank you very much, John Paul. I like the part where he said our policy makers. In Kenya right now, we happen to be going through an election process. So sometimes even that disruption of the political landscape may also halt the thinking that we have for our research. Professor Mwau, you have something that is already moving. Let us hear it from the perspective of from good to great. Konza City happens to be an environment that has been created by the Kenyan government to spur up innovation and also open up our market opportunities. If there's one of us who's seated in the room right now, and their line of research is not necessarily small, but has the capacity to fit within a brand proposition like the vaccine space is creating right now, and the element of the government support, how did it work out for the smart vaccines production unit that is there, for which you're the head? Was there leverage for you because then maybe you had exposure to this area of interaction of research, or was it something that you were able to coin and put in together? So we are looking at your current reality and experience heading this unit and also being at the Konza City.
Thank you very much. And I would like to say two things. First, I'll say about myself, and then I'll tell you about Konza. And I'll say them in the context of innovation. The first thing that you must think about is the market, is the client. What does the client need? Sometimes the client knows what they need, sometimes they do not know what they need. The second thing you must think about is the ecosystem that will help you commercialize the thinking that you have. The environment, including policy, including support, finances, collaborations, and so on. I'll give you an example and then I'll go to Konza. In 2007, around June, I decided that Rift Valley fever, a certain infectious agent, was a problem for Kenya. I decided that because I saw what was happening in abattoirs, what was happening in wild livestock, and what was happening with politicians and the noise they were making, and the newspapers also. So I asked myself, okay, so what needs to happen here? We need to have a diagnostic test for Rift Valley fever. And who will buy this thing or who will use it? Kenyans, probably the Ministry of Health is going to buy, probably, okay? Do we know how to make this thing? Yes, I knew how to make it, or I thought I knew how to make this thing, or I thought I was good enough to know how to make this thing, but I decided to bring people around me to try to make a test for Rift Valley fever. And what I did is I wrote a proposal, a research proposal, and then I went knocking on doors and saying, give me money, I want to do this thing. So somebody was interested and they decided to give me 44 million shillings. So I took some of that money, I decided to do some experiments, and some of the money I sent somebody to South Africa, to the National Institute of Communicable Diseases, where I knew there was an expert in this area. Cut a long story short, if you look in Kenya today, you'll find a test called RVF immunoline, Rift Valley fever immunoline. It's a test for Rift Valley fever. That's a nice part of the story. That's understanding the client. The other side of the story is that I did not understand the ecosystem. So where you'll find the RVF immunoline right now, you'll never hear my name being mentioned because I did not understand the ecosystem. Let me go to Konza. Now, there's somebody called Gabi. Gavi has been helping Kenya to acquire the vaccines that you are familiar with, many of the vaccines that you are familiar with, so that Kenya doesn't pay very much, and Gavi pays a lot of money for Kenya to have vaccines. Okay? But in the recent past, it has appeared as though Kenya has begun to become wealthy, or has left the bottom of the pile and is somewhere near the middle of the pile right now. In fact, Kenya is probably the 6th or somewhere between 7th and 5th largest economy in Africa. So Gavi said, we're not going to give you money anymore for vaccines. So you buy them yourself. So Kenya sat back and said, no, we don't have that kind of money. Then people said, okay, how about if we make them ourselves? And because some other countries in the region are starting to become also wealthy, they're going to face the same difficulty. And the issue is that there's going to be a market for these vaccines, not only in Kenya, but also in the region. So when Kenya said, let's make vaccines for ourselves, usually on the other side, people say to make a vaccine means making a factory, a big building, and then some machines making some movements inside. This thing costs money. So what Kenya did is that Kenya started asking international partners who can give us the money for this kind of thing. And I'm answering this part where the Korean government came in and said, we have resources to do this, and some of the people inside South Korea have already attempted this sort of thing in Myanmar and in Vietnam or somewhere, and in Vietnam it has worked out and they make their own vaccines, and maybe you can do the same. So the Korean government committed to support Kenya to assemble a vaccines factory in Konza. And the first commitment was $1 million per consultant to do a feasibility study, and $100 million to begin the first components of the vaccines production facility. And because we know how vaccines work out, then the first part there, and we have this time now, between now and 2027, to get our act together right. So this is a very short period of time for you to start from research and development and go all the way to making vaccines that you can inject into people. So the best thing for us is to borrow the technology from other people, probably pay royalties, and then bring the technology here and then finish the product. So get the ingredients, put them together, label the bottles and the injections and inject people as we are thinking about the R&D. And then strengthen our R&D space so that people know how to do this from scratch, okay? So this is the arrangement that is there at the moment. The basket, from where that money is coming, from where the 100 million is coming, the basket has about $1.3 billion, okay? But the 100 million is easy. The remaining money is much more difficult. You have to convince the Korean government that you actually know what you're doing for you to be able to flow into the remaining part of the $1.3 billion. But you are doing a good job where the consultants in this place. The question for you is this. This is going to be a very huge activity, and Kenya will be a huge hub for vaccines. And you need to ask yourself, what skills do I have? Which vaccines do I know about, and which ones do not exist that I may be interested in? If you're a businessman, am I in the marketing space? Am I in logistics? Where am I? What can I do differently? These are some of the things you need to think about as you think of that ecosystem. Thank you.
You see how people clap when money is mentioned. I could see heads popping up when he moved from $1 million to 100 until he picked up on the 1.3 billion. The only part you forgot is that there's hard work involved. Now, anytime that a researcher starts their process, as you hear, there's money involved. And in more often than not, it's never little money. But how does someone begin their journey with the understanding of what they can make out of it? Then there's a bigger question of who will consume the idea, the product, or the concept, whether it turns out as a service that you're creating. Professor Pradhan, by virtue of you having some exposure in capacity building, could you build our capacity in understanding how when the young man, old or young, you didn't mention, at the airport was done thinking about perfumes in A or B and patenting them, how do we take advantage of that space at a very early stage? Speak a little more about the royalties element, and also the aspect of prototype. There's starting part before it goes to market, and then what happens when actually it is part of market. And if you could also enable us with, Professor Mwau's name was forgotten down the stream. How do we make sure ours is part of the stream?
So any country to be creative, to be innovative, I think the youth are the power. We heard interesting and very useful inputs about country level, national level kind of vaccine, all big products and all that. But every citizen, every student studying in the college has a role to contribute. And to do that, I normally take a session called orientation. How do you orient the young brains to think creative, think innovative, so that something comes out? And let's say in a nursing college, in a pharma college, in a allied sciences college, medical college, we throw this idea. Think what is that is still not available in the medical fraternity, in the healthcare fraternity, which is still creating trouble among the doctors, among the nurses, to give a quality service to the patients. I'm sure there are many gaps, many. And then they think about it, so there is a need, they can see it. Then they try to create an idea, okay, what could we do? And then we suggest them, because you all are technocrats, you are a pharmacist or a doctor or a nurse or whatever, please involve some MBA students, management students, BBA, MBA, BCom, whatever students, so that they start creating a business model for you if you want to go for commercialization later. Also, let me tell you, not every idea can be commercialized. But whichever ideas can be commercialized, they should involve a business team, MBA students, BBA students into the team to do the market scoping. How many products I can sell, where it is required. So that's what we do. I'll tell you my example itself. I did that when I was 5 years before. So when I was talking to my doctor friends, gynecologist, they said, Kirti, we're having trouble that during delivery, there is something called, see, I'm not a doctor, I'm not a nurse, I'm not a pharmacist, but I'm a person who catalyzes, who creates a catalytic effect. So I said, okay, what is the problem? They said, there is something called peritoneal retractor. Those who are gynecologists, they would understand. Peritoneal retractor, something when the child delivery happens, you retract. So then I said, okay, show me the angle. They showed me the angle. Then we started thinking about it. Let's create peritoneal retractor. It's like a scalpel, very simple. It's not a rocket science. But that was a deficiency in that community. And with their help, we have patented actually. If you Google my name, you'll find Kirti Bhushan Pradhan peritoneal retractor. I patented. And we are going for commercialization now. So from patenting the idea to patent to commercialization. So patent we did. But then I needed money, little money, to make some sample products to be used by the gynecologist. I needed $3,000. I cannot be spending from my pocket when I don't know what is the market. So we got a funding from, while hunting around, we found somebody who wanted to give that money through a grant proposal. And now it is at that stage, some pieces are getting made, which are out of steel product, in a 3D model. And that will be given to the doctors. It will get piloted. Then we are already started working on the how many gynecologists in the country, who will be using it, what will be the pricing. If you have to produce this many pieces, what will be our profit? So the business planning has started. So what I'm trying to tell is, I think the colleges are the right place to create that spark on thinking innovative, creative. And there are many gaps, let me tell you. There are many gaps in providing healthcare services, which can be an idea generator opportunity and also a commercialization opportunity. And the pharmacy is a big opportunity, let me tell you.
I think at that point, I picked the part pharmacy is where the big opportunity lies, because I'm a pharmacist. I picked the part that in colleges is where it starts, because I'm at the Strathmore University Business School. So you're in the right place, people, and you can see us so that we can help to knowledge manage the ideas that you have. So at this point, I would like us to give a very warm clap to our panelists in an interim version. Thank you for that practice. Now I want to show you how I want us to do it, then I'll open up for the floor's interaction with the panelists. Rub your hands together. Rub your hands together. So this is what we want to share out with the panelists. So I will say pasha, 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 and then when I say pewa, you clap it out to them, all right? So pasha, 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 pewa, tena, tena. Thank you very much. Nelson, I think at this juncture we are ready to hear out from the floor in terms of questions and answers. Feel free if you have someone you're directing it to in terms of the panelist who's here, and also feel free to just say it's open to all. So we'll pick up the first three, go into a response, and that's the format we shall use. I see there's a lady here already with a mic. Karibu.
Thank you so much to the panelists. That was quite insightful. I have a couple, some will be comments and others will be questions. And it's open to everyone. So the first one is on idea theft, which I think happens a lot, especially in our market, whether it's in the academic field where you have a student and then you find the supervisor has actually run with the idea. So how do we support and protect such ideas from theft? The second one is a repository. I think that's one of the things we really struggle with. I don't know if I introduced myself. My name is Dr. Wala Elizabeth. I'm the Vice Chair of Kenya Healthcare Federation. So the second one is repository, which is we have everyone doing everything. And I think for some of us in the health system space, we struggle to have visibility, like in a wider picture. Is it something that we should be working towards, especially given that we are now going the after way? How do we support, especially with the regional professional bodies, to have one repository or a common repository? Then the other thing that I encounter is the Me Too kind of ideation or research. So everyone is doing the same thing, especially in data, in electronic medical systems. I don't know how many other I've come across. So how do we also try to be more innovative in other areas so that we are not almost all of us doing the same? I'm very passionate about gender, so the panel is very male heavy. But the same thing speaks to what is happening in the research sector. How do we encourage more women to really take up some of these positions? And last but not least is in terms of most of the support maybe is towards tangible ideas. So for example, Professor Mao's immunoline, but what about a service kind of ideation? Or things that are not, visible or tangible. How do we support some of these ideas? Because I think many people are looking for something that they can either launch or cut a ribbon towards, or put a picture to it. Thank you.
Wow, thank you very much, Dr. Wala. We can take one more because she had quite a bit, so we can take one more. Thanks.
Thank you. I'm Henry Opondo. I'm a physiotherapist by profession from Karen Hospital, but with a lot of interest in health system management. I want to appreciate the panelists for the remarks you've made. I just have two concerns, and it's open to anyone can chip in. One touches on the issues to do with the human resource for health. I think, Dr. DeWitt, you did mention that we do have research, publications with recommendations and so forth, but when it comes to the ground, we really struggle to implement what is documented on the paper. And to me, that raises, my concern is now comes to the issue of human resource. As much as we are pushing for a specialized medical care, investment in health, and innovation in healthcare solutions, we are getting super specialists from the human resource, meaning people are getting highly technical skills, but we are not also investing a lot on the soft skills. These soft skills, to me, are very important along the technical skills, and that's what brings the discrepancy. How do we package a training whereby, as much as we are getting a highly technical person, but also we have very high soft skills that will be very useful in the implementations of any document that we have. Number two is to, I think, Mr. John Paul. I think you talking about regulations, policies from Africa level. Let's move from Kenya and talk about Africa and the spirit of what you're saying from good to great. But before we leave good to great, if you look at our setup currently in terms of regulating the medical products, the drugs and the non-drugs, currently I think it is one body that does the regulations. But we've seen a trend whereby there are players who, I don't want to say they sneak in products in the name of medical products, and these products, some can be classified as alternative medicine, and they get into the market, they harm our patients, they ban our patient, but when you do background check, you find that they were approved by someone who is also knowledgeable, but perhaps they're knowledgeable on only pharmaceutical drugs and not non-pharmaceutical drugs. So how do we also strengthen these issues of regulations of the products that are coming in the body? Should we also have key players? Because medicine is broad. Thank you.
Thank you very much. I think we can start off with John Paul, because there's a particular question to you. Then I open up the remaining queries to the rest of the panel.
Thank you so much, Opondo, and I think I'll also respond to one by Dr. Wala. So, thank you so much. I think when you're talking about, let me call it the substandard on falsified medical products, of course, Africa and a number of our lower middle income countries are still having the highest amount of these products in the market. However, we have seen a very strong surveillance system that has been put in place across the continent and between even across at the border stages, where a lot of these products are getting in. The problem we are currently facing that I think our agencies need to put in place is the products sold through the internet, the e-commerce. A lot of those, especially the non-farmers, are getting into the product, into the market through internet, or what we're calling the e-commerce. And that's another place we need to tap in. But to your question, I think number one, we need to strengthen the surveillance system and the reporting system. We have products that are in the place that have special tracking features, and I think we are even getting, of course, the scrupulous individuals are also heightening their behaviors. So we also need to make sure that the special features that are meant to authenticate good products are getting to a level that, number one, you can easily pick. And if something is substandard, you can report. So there are two levels to that. There is the level from the supplier side to be able to have special features in the product. But on the demand side, we also have we have the electronic reporting system. I'll use the example of our country, Kenya. The Pharmacy as Poisons Board has a number of reporting platforms. We have the web-based, where you can just go report an adverse event into the system, and a team would come and assess that. We have shortcodes that we can use. In Kenya, we also have the QR codes that you can just use, even if you just suspect this thing is substandard or is fake. There are even QR codes that are online that you can even report. We also have, apart from Pharmacy and Poison Solve, we have the anti-counterfeit agency, aka SEA, that you can also report. And they also have a number of platforms and mechanisms that you can use to report. I think safety starts with us. We are always encouraged, please buy products from, authenticated shops, or those kind of places. But the most important thing we need to do is, do you know how to report? Are you able even to Google? All of us have smartphones. You can Google and be able to report. And for sure, those people are able to call you. They will be able to call you, because even the phone numbers that you can just call or SMS, and you'll take a picture through WhatsApp. You're able to send, the anti-counterfeit has that. You're able to send, and they'll follow that product all the way backwards. So that's I think, something that we need to adapt as citizens, because that is important. The other question that came in is the issue of the repository. And I think you are very right. And when we're talking about the research architecture across the globe, if I ask us today, and we have researchers here, are also in the room, including yourself, Dr. Lucy, how many clinical trials are being done in Africa today? Exactly. And it comes to her question. No one knows. About in 2019, we held a similar thing here around research. And somebody asked the same question. We were in the other room, I think the other, yes. Someone asked the same, and we agreed that we will bring all our researchers in the room. We are going to start thinking about a repository. And the question is, there is none in Africa. In the US, if you go to the NIH website, there is a very clear repository of all the clinical trials that are happening within US and Europe, who is funding them, how long are they taking, what are they targeting, and at the end, and no one funds clinical trials before going into that website. Can we think about a similar thing for Africa? And can we even start from Kenya? Always Kenya, when Kenya leads, the rest follows. So I think it is important that we go that route and we strengthen that, because if we come together, then we are also going to create a lot of efficiencies within the research field, so that we can capitalize on the expertise that are in and expand, stretch the shilling or stretch the dollar, do more with less. Thank you.
Thank you very much, John Paul. And I can see he's already started opening up spaces of what we can consider as calls to action. So I'll allow us just to go in queue the queries that had been raised by Dr. Wala, and also the element of human resources for health by Henry. But just to chip in, Henry, there's already something going on in terms of alternative medicine. There's some input process going on at policy level right now. And to give you comfort, at the level of the Pharmacy and Poisons Board in Kenya, they're actually experts who preview the supplementary or complementary or alternative medicine space. So they don't just get into the market that way. But also, because it's also a free space, free market, there's the element of the gaps that are there, but at least now some policy work is going on. For the benefit of the panelists, Dr. Wala had raised a query around idea theft. I think the conversation around repository has already been commented on, so we can move on to the next one, where she asked about the Me Too. It was quails in Kenya at some point, I don't know that happened also in South Sudan and Ethiopia. Then there was also the question of gender uptake. Her concern here was, is this a representation of the reality on the ground? We have 5 gentlemen who are here to panel with us. Then there's the issue of the service type of idea, which is very critical, because not all research elements end up in product. There are some that end up in service. And then the final query raised by Henry in terms of human resources for health, the aspect of packaging beyond the technical skills, and trying to look a little bit more into the soft skills area. So we will start off with Dawit, and then come all the way towards Professor Mwao. Karibuni.
Thank you, Dr. Lucy. I'm glad, Dr. Henry, you raised the HRH issues. On any research, they will not tell you what is available exactly in the market. when it comes to HRH skill and their efficiency and so on and so forth. So that's one of the things that makes the road bumpy. To give you my own example, after setting up the hospital, employing all the staff, and rolling out the service, one very big issue that we saw was the security guards. Okay, coming to the hospital, they've been trained to guide you where to go, why you are there for, and so on. But due to the lack of that soft skill that you said, he'll stop you, you roll down a window and ask you where you're going, and you'll say, okay, I'm here for medical attention, and say, do you know which doctor you're going to see? You say, no, I'm going to go and check, blah, blah. And then imagine with that patient psychology, you want to get immediately a very good, effective attention. And here is a guard putting you another 2.5 minutes, forever for you, okay? So that type of lack of skill cannot be known unless when you walk the talk. Come to the reception, the same thing. You'll give them training after training about being hospitality, about being so friendly to your patient. In fact, recalling their name, if you can, and so on and so forth. And still, we don't know what we get unless you get there yourself and see the situation. So that is one of the most difficult parts that we see when it comes to health service rendering. HRH is, I can go up to the top, to the CEO level, okay? We don't have that much people that are trained as we, the private sector, want them to be. Most of the senior doctors, the senior management, the gurus, we get them from the public sector, okay? And what they do have as an experience in the public sector and what we expect them for the money that we pay and for the service that we expect doesn't match. That's why I say we have to reboot ourselves, okay? We have to go into a different kind of ball game when it comes to giving service in the private sector. In HRH, Dr. Aini, you're right. That's very difficult things that we have seen. And to tackle, if you allow me, Dr. Lucy, Dr. Wall's question about thefts, okay? Yeah, here is my friend, Dr. Mohammed, who are also running his own hospital. We're friends. We do have, common interest in the market, and we can also be sometimes competitors. But I'll tell you what, I'll go to his lab because my background is a lab. I'll go to the hospital, and when he was building the hospital, I told him, no, I had made this mistake when I was building my hospital. So don't do that one and do this one. And because he is gastroenterologist, when it comes to our internal department, internal medicine department, I'll call him and say, do you think this machine is proper to buy it? Or do you advise me to go for another supplier? So this type of idea exchange is there. Of course, the theft is also there. But I'll tell you what, the whole globe is becoming a small village. You can go into the internet and get whatever information that you might get, unless you're looking for the formulation of Coca-Cola. Otherwise, but there are some tips, but I'll take it in the positive way of sharing ideas. Thank you very much, Dr. Lucy.
So in my view, I think ideas theft can be prevented by patenting it. There is a patent law, and each person should patent it first before getting into the market. That's very clear. In terms of research with a faculty, where faculty dominates, takes the idea of the student, I think students should insist that his name should be there. Let the faculty name also be there. But then that's the way it goes on. And once you patent it, before patenting, please don't reveal it to the open market, everything. First you patent it, and this is a law. Patent is a law, so there is international patent. Sitting in Kenya, somebody can patent it in US. In fact, one of my friends has done a patent of a product for prostate cancer sitting in India. From some vegetable or fruit, he has created an item which is patented in US. Very strong patent, so he can globally do it. So anyway, so that's one part. The second part is a lot of time I hear about government policies, papers and all that. I always say one thing. Who is government? People like you and me. Today we are here, tomorrow we may be in the government. So it's all human beings like you and me. Government is not God. Only things we cannot change which God has created. Sun rising in the east, setting in the west, we cannot change. Only women can carry a baby in the womb. We cannot change. But the rest of the things, whoever has created policy documents, this paper, that paper, it's a human being like you and me who has created. Today, by virtue of his power and position, he is sitting there, he or she is sitting there. We can change it, let me tell you. How do you do that? We have done it in smaller pockets. If we feel there is something which the policy which is not conducive to our work, to our country's growth, we create a pressure group. Quickly we create a pressure group among the people, among the interested group. And that pressure group keeps attacking the government, that government man or whoever is the policy maker sitting there, keep attacking. Hey guy, your policy is a bottleneck to our growth. Your policy is a bottleneck to our growth. Let's change it, let's change it. And often I have seen, because as I said yesterday, I have traveled to 23 African countries. Either the policy document is copied from another country, or they have engaged a consultant who has no understanding of their country. And that consultant has designed the policy, paid by some international NGO. Okay, and that is kept in a beautifully bound book in the government's almirah, locker. These are very sad things, so I think we should create those pressure groups, be very practical, the way I explained. Only God created things we cannot change. Rest, everything can be changed.
Thank you very much. Dr. Emmanuel, your comments on, he had stepped out shortly, but the areas of feedback we're looking for is around idea theft, the Me Too idealization, the element of gender, representation in the conversations around commercializing research, the aspect of service type of idea versus product, and then if you have anything to say about the HRH skill sets.
Okay, apologies first of all for leaving early. Just had to sort out a couple of things with my colleagues as he's actually on the way to the airport. So I missed out on some of the questions, but from what I got from everything else, and Dr. Wala, just quickly, with regards to, I will tackle, let's say, the Me Too and the theft more or less together. When people see an idea, or when you have a vision and you come up with an idea and it's happened so many times and you trying to monetize it, everyone will try to go after it, to try to get the same share of the pie, because it's a big pie, then everyone will try to cut it. And if you look at it from back in the day when the internet started, you had all these search engines. But of course, Google came out to be the best. And the rest of Yahoo, what all disappeared in the woodworks. And then Uber came in. Now you had all these other Bolt, this. In fact, in Ethiopia, there's one called Taxiye. And Taxiye actually is actually working in Kenya as well, but doing motorbikes. And the owner is a very good friend, by the way. And yeah. So, I mean, everyone is trying to get the same idea and duplicate it and replicate it and trying to target the same market. The thing is, how do you differentiate yourself? And this is now where your creativity comes in, because it's your creativity that will make you different from every other person and actually make your idea stand out. And it's how you market it, who your target client is. How, for example, Google kept their, I don't know if most of you will remember how Google kept their website nice and clean and simple, with just a simple bar. Well, if you look at Yahoo, it was just a mess of links and this, and you don't even know where to start So if you need something, you have to go there, and it was very user-friendly. So some small things like this come in actually handy in how to differentiate yourself. So be ready to weather the competition, and that's where your resilience will come in, and be ready to innovate. Keep upgrading. Gender uptake in STEM. I'm not so sure whether it was just by coincidence that we're all men here. So for that, yeah. But if I was to give an example of what's happening in South Sudan at the moment, there is a small incubator which is run by women, and it's actually all run by ladies in STEM, and they actually get a bit of funding from the government, from business people. They actually go around to business people, raise funds, and they build a small lab and everything else, and they actually go to schools to encourage girls to join into the STEM sector, as well as give talks and all that, try to help them with university applications and scholarships, and mentor them all through, because it's something that they actually didn't get at that time, and it's a very good initiative. They never got it when they were joining the industry, whether it's in medicine, whether it's in IT, or whichever bioscience they're doing it, or they were in. They never got engineering, they never got it. But they realized that there was a gap, and they actually want more people to join in. So they teamed up as a small group of women of different age groups and started doing this. And now it's gathering more and more momentum and encouraging more women or more young girls to actually go into the science field, because a lot of them are thinking the science field is something not for us, until you go and see, and this lady comes to you and say, yes, I am a petroleum engineer, I am a doctor, I am an IT profession. And sometimes you have to give they need the example out there to actually follow. So something that I think you should look into and encourage more people to join into the STEM industry. Otherwise, we may just end up being a male-dominated area. Thank you.
Thank you very much, Dr. Emmanuel. So we can hear out from Professor Mwao.
Does it work? Yeah, thank you. So I'd like to start by first contextualizing Opondo's question with regard to innovation or research and development. In the streets, in many countries, most people believe that innovators are dumb or scientists are dumb. They know their thing and they know it very well, but outside of that thing, outside of their technical area, they are useless. So how can you address that? Because your technical idea is not enough. You need to work with people, you need to get funding, you need to commercialize, you need to become rich. How do you sort it out when you start off as a technician? The thing is, first you must acquire emotional intelligence. So when you are sharing your idea and people on the table are not understanding, you can't be asking them, are you stupid or what? You can't be doing that. You need to have emotional intelligence. You have to have very good communication skills. These things are learned. Sometimes you need to be heading your team, so you need to acquire leadership skills. You need to put in more effort than anybody else, so you need to be conscientious, more conscientious than just about anybody. And then you require spiritual fitness. Not the fitness where you met Jesus and things happened, but the fitness where when your idea is stolen, you don't hang yourself. You understand? You need to have spiritual fitness. Okay? So there are additional skills over and above technical skills that you require for you to succeed from that idea you have into something that's useful for the people of Africa or the people of the world. Now, coming to gender, this is what I have to say about it. In countries that are very egalitarian, like Nordic countries, like Scandinavian countries that are very egalitarian, where you can be anything you want and you can say anything you like, women do not like STEM subjects. They have freedom of choice. And yet, without STEM subjects, you can't get where you want to go. So, with regard to STEM and with regard to women, there can be no freedom of choice in a country like Kenya. You have to encourage them, you have to do affirmative action, you have to mentor, you have to do everything you require to do, because when they catch on, they quite often do better than men. So this is what I would like to say about the gender thing. In terms of them sitting here, I think it has been addressed. Then the other thing I want to talk about is a repository. This is what I would like to tell you. There is no one place where you can find everything that has been done in this country that can help you decide what you want to do next and that can help you decide not to replicate. No one place. And in my experience from around 2013, This is, to me, almost a deliberate action to ensure that such a place does not exist. You are never going to have a repository here unless the very top leadership of this country says we must have it. The lack of a repository at this moment is beneficial to many organizations and individuals. That's what I have to say about it. Then with regard to idea theft, first of all, please be careful. Be careful with your laptop, be careful with your mobile, be careful with your notebook. Just the way you lock your house when you are leaving and so on, just be careful. Lock up your things. Also, don't just say random things in the streets with regard to ideas. Don't do that. Then there are laws against plagiarism and policies in institutions. The patent thing has been addressed very well. Then there are intellectual property policies that need to be followed. In many institutions, they exist. And then when you are entering relationships with collaborators, where you want to share an idea because you want to get to the next level, please formalize that relationship. You know, when we are holding conversations with like a big pharma and so on and our funders, we begin by having non-disclosure agreements. You're not going to talk about this thing to anybody over your dead body. So it's the same thing that you need to do for yourself when you have ideas. And that's all I have to say about this matter. Thank you.
Thank you very much. All right. I have been given the warning signal that collectively so, the precious time that we had to share this conversation has come to an end so that we can allow you to hear into other topics. As a way of exit, I will allow the panelists to just give us one thing they would like to leave us with, having been very agreeable with the ideas that you've given us, and also there's room and opportunity for us to interact some more. So starting with you, John Paul, one takeaway.
Thank you. I saw that coming this way again. So I think for me, it's the value proposition that we need to put in place whenever we are doing research. What is the return on investment? The biggest procurer of a lot of these things are governments. Can governments see the value proposition for the solution you are bringing in? Or can the community see the value and the return on investment on that? If you have that at the end of, if you start with the end in mind, then a lot of our research to commercialization will take effect. Thank you.
Excellent. Thank you very much. David?
So the path from, excuse me, the path from research to commercialization, the road is, as I said, is very bumpy. We have to have that resilient nature to face things. But the main thing is, apart from what the research results shows, we have to believe in ourselves, in our capacity, and on the idea. If we do have that faith, we'll do it. Thank you.
Thank you very much. Professor Pradhan?
There is something called responsible innovation is coming up. The way we are creating the momentum of innovation and commercialization, at the same time, responsible innovation. There is a book somebody has written, you can Google it. Not many books, only 1 or 2 books are there on responsible innovation. What it means is, when you are taking your innovation or idea into the community, into the society, into the humanity, please be sure that you have involved a community member, a community leader, a lawyer, a technocrat, a IT, whatever, a committee, and present it to them before going into the market. So be responsible in innovations also. Thank you.
Thank you very much. Dr. Emmanuel?
Thank you very much. From research to commercialization, the hardest part will be the commercialization, actually. And somebody once said, business school doesn't teach you how to do business. It actually teaches you how not to lose money. So as you're looking at going from research to commercialization, learn on the soft skills. Learn on things like marketing, team building, leading teams, leadership, and from your marketing to accounting basics and all that. Take your time. Nowadays, there is a lot of information online. YouTube has thousands of courses. You have Coursera, you can do so many online courses. And this will actually help strengthen your view in your idea and how you're going to actually monetize it and how you're going to bring it up and actually discuss it, for example, if you're looking for funders and how to sell it to the market and all that. So please take your time as well to focus more on the business side of things, because it will help you weather some of the storms as you're going through. Thank you.
Thank you very much. And finally, Professor Mwao.
Thank you. I just have only two things. The first one is, in the nascent vaccine industry, what role are you going to play? The second thing is that the customer is king. Does your idea address a customer's needs in a new way, in an innovative way? Thank you.
All right. So this particular session for us this morning that was looking at commercializing research has some of the elements that can go into call for action, the conversation of a repository, the conversation around human resources for health. We are all experts in the area we have, but the soft skills element is key. The aspect of the business of research. And finally, the component of networking, because it's not by you alone that you can achieve the objective that you want. You are hosted by the Strathmore University Business School, so do trust that we have everything it takes as knowledge partners and also as the kind of people who can assist you to convert your research into a commercial entity. And I want to say thank you very much for this morning's session, Professor Matilu Mwao, who is the head of the Smart Vaccines production at Konza City, Dawit Moji, the Secretary General of the Ethiopia Healthcare Federation, Dr. Emmanuel Togun, the private health sector association in South Sudan, and finally, but not least, John Paul Omono, the Senior Advocacy and Policy Officer at PATH, and Professor Pradhan, the Healthcare Management Professional and Capacity Building Expert. So I would like you to say thank you to them in the style that we did earlier on of Pasha, Pasha, Pasha. They have done a wonderful job, isn't it? All right, Pasha, 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 Pasha. Pasha, 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 Pasha. Hewa, Tena, Tena. Now, the easiest way for the panelists to gauge whether indeed what they have shared with you this morning has left you better than they found you. Let us start off with, how many of us are feeling so? Okay? How many of us are feeling great? Aha. And how many of us are feeling excellent? Perfect. So my panelists of today, you have achieved the greatest objective of this hour, to ensure that we have left everybody in an excellent state. It has been great interacting with you. Again, my name is Dr. Lucy Mturi, a faculty member here at the Strathmore University Business School, and I do wish you a wonderful rest of the Expo. Thank you very much.
Thank you so much, Dr. Lucy, for the presentation and for the insightful session. I hope the session was quite insightful and you got good concepts on the same. So at this particular point, we'll jump in as, I don't know whether the tech team can confirm whether we have Dr. Kevin Desai ready to give us the keynote presentation. Then we'll go back to the two presentations from HealthX and Penda Health. So, so you can stretch a bit just where you are for a 1 minute as we set up the keynote presentation. So as we set up, I'll call upon HealthX to give us the presentation that we proceed. So I'd like to call Dr. Martin Macau to come and give us his presentation.
Thank you very much. It's a pleasure to be here. My name is Dr. Martin Macau. I'm representing HealthX Africa. The technology